If you're hoping your future son doesn't get shortchanged downstairs, the first instinct is usually, what can my pregnant partner eat to make sure he has a big penis? Here's the hard truth. You can't override genetics. There is no magic food that guarantees a huge penis. But there is a way to avoid getting in the way of healthy development, and that's where biology, hormones, and smart nutrition come in. The real foundation of penis size. The starting point isn't a supplement, a superfood, or some secret tribal recipe. It's testosterone. During pregnancy, there's a critical window, roughly weeks 10 to 15, when the unborn baby boy gets a surge of testosterone. That hormone wave shapes male sexual development, including penile growth, within the limits of his genes. You can even get a rough clue about how much prenatal testosterone you were exposed to. Look at your index finger versus ring finger. A relatively longer ring finger compared to the index finger has been associated with higher prenatal testosterone. It's not a perfect test, but it's an interesting clue. Intrauterine testosterone is the first boost for penis growth, but always inside your genetic blueprint. And that blueprint comes from both parents. There's a popular idea that penis size is from the mother's side. In reality, it's polygenic, influenced by genes from both mother and father. Some sex-linked genes may come through the mother's X chromosome, but it's not as simple as only mom decides. How diet and environment can help. Testosterone is powerful, but it needs a supportive environment to do its job. That's where maternal diet and exposure come in. Let's start with the enemies. 1. Ultra-processed industrial junk. Ready meals, ultra-processed food, stuff that sits in plastic for months, often come with plasticizers and softeners. These are endocrine disruptors. They can interfere with hormone signaling, blur or weaken the testosterone message the fetus is supposed to receive. Refined sugar bombs. When the mother's diet keeps her insulin constantly high, think sugary drinks, desserts, white flour, constant snacking, it can increase inflammation, alter placental signaling. Testosterone doesn't like this kind of noisy, inflammatory environment. 3. Alcohol and nicotine.